Namaste. So today I'm talking to you as a dentist. Okay. On three aspects, I want to talk to you because there is a move by many people telling don't use toothbrush. One. Second, use either salt or turmeric to rub on your teeth and rinse. Third, root canal treatment should never be done on your teeth. It's very dangerous. Okay. So, do you have any authority to talk on this? I was trained in two of the best colleges in India. Okay, graduation from Trivandrum Government Dental College and post graduation from King George Medical College, Lucknow. Then I taught for 4 decades in dental schools where I guided the postgraduate students. So, teaching in a college has so many advantages, because the students will be making mistakes and we have to correct them. We have to exercise our brain how to correct this situation. So, I used to tell that because I'm teaching students, I get to learn from thousands of mistakes without making the mistakes myself on the patients. Okay, because initial days, when I used something goes wrong with the patient, I used to lose my sleep that day. Even though it was not my mistake, I used to feel like that. But as I got into the spiritual training and other things, it is not there right now. But yeah, so and then the postgraduate students, we had to keep all the records. We are following up the patients, and then I had my private practice where I've seen patients. 4 decades means, yeah, I've seen those patients retaining the teeth with root canal treated teeth in their mouth, and they feel so grateful. The moment they see me, they say, "Doctor, I'm still chewing on that tooth because you did root canal for me 30, 40 years." Okay, so first of all, I want to tell you that I have a very strong sense of smell. I never forget a smell which I experience, and my memory is very good in that aspect. So, as a small kid, I have seen my grandfather's mother, that is, my father's father's mother. And so, we are small kids when we use, they will hold us and give kiss and all. And her mouth used to stench. Okay, so I had to literally stop breathing when I was very close to her. Then I come across some other old people also. So this idea came into mind. The old people's mouth have very bad smell. Okay. Then when I was doing dentistry in third year, my grandmother, my mother's mother, showed me her teeth and told, just see whether this filling is still all right. She had an amalgam filling in her mouth. That means she had been to a dentist. I don't have much more detail apart from that, but her mouth did not have that stench. Okay, did not smell bad. Then, of course, my parents, I did single sitting root canal treatment for my father, my mother. They retained their teeth till they died. They had teeth in their mouth. Okay, they were using brush, night brushing, everything. Once we became dentists, I took care of that. But my husband's parents could not retain their teeth till the end because they did not believe in us as dentists. Once they had come to our place in Belgaum, and she was having some problem, my mother-in-law, I checked and told that, I was a very well established root canal treatment specialist by then. I told, see, there is a discharging pus is being discharged from your premolar. It needs root canal treatment. Then she reacted as if she had seen a snake. No, 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 no. I don't want to get root canal treatment. I told, see, I'm just telling you. I'm not asking you. You have to get it done. She never got it done, and she had some extraction, some partial danger, and things like that. So, and my effort throughout my dental career has been to educate the patients. I tell them, you take this simple things. You don't have to visit a dentist except that once a year or once in 6 months, because whatever care we take in brushing, soft deposit form and they form light hard deposits, which will not go by the brush. So once a year at least, you have to get a cleaning done by the dentist. That is very important. So there is a saying that you use the brush, it injures the gums and it gets infected. Really? So do you use sugarcane? Does it injure the gums? It injures gums. Brush doesn't injure the gums, for your information. Even if it injures, immediately infection will come. Where did you learn that? We get so many cuts and other things in the body. Do they all get infected? Infection is a different ball game altogether. Just because, and even in our body, it heals. Inside the mouth, the saliva has very good antiseptic properties and all. In the mouth, it heals faster than other parts of the body. Okay, so first of all, brush doesn't injure if you are using properly. Of course, you pinch on the take the brush and poke it. Yeah, naturally it will. Otherwise, normal brushing does not injure the gums. And even if there is an injury, they all are not going into infection. Okay. Then there was an advocate of use only the turmeric. Use turmeric to rub your teeth for cleaning daily. I was very curious to see where it is leading to. So, recently I met a person who is an assistant to somebody else who was advocating turmeric. So, this assistant was also advocating turmeric for patients, and the main boss went to some other place. So, now the assistant has to deal with the clients who are coming back. Okay, so he was very perturbed. He told me, "Madam, all these people are coming back, telling we are using turmeric. It is staining the teeth, and I don't know because he's not a dentist. Okay, he was just following the boss's orders. Madam, what should I do? I have no idea. The clients are coming, patients are coming back and telling we are getting stained teeth. What should I do now? Okay, so basically we need to use the brush to clean the teeth. So if you don't believe, you do one thing. You take salt or whatever you are using, use your fingers and spit out. Okay. You think it is all clean. Then you just use your brush. This you have to do after a meal. Okay. So then you do brushing with your brush properly. I have another presentation where I explain how the brushing is done properly. Do the brushing properly. Just rinse your mouth and spit out and see how many particles are coming out. So when these particles are sitting in between the teeth, there are bacteria in the saliva. They act on that and produce acid and spoil your teeth. So this is what's going to happen. So you have to brush properly with a proper brush every day, because even if you look at the diet, earlier days it was roughage was more, and nowadays what pizza, bread, chocolates, eating chocolates in between. So all these things. So use and that earlier times, they were having 1 or 2 meals a day. Nowadays, we are eating throughout the day, isn't it? So, and through eating throughout the day, not rinsing the mouth, so these all create problems for the teeth. If you take care, we eat once or twice a day, and the moment you finish your meals, rinse it thoroughly, vigorously, and clean the mouth, then you can have your teeth till you die. You don't have to go to the dentist for some work to get done on your teeth. See, cleaning is different. Cleaning, you have to get it done. So if there are no decay, there are no fillings needed. Okay. Now, when the decay goes deep inside, there is no other way. Once it involves the pulp inside, there is no other way. As of today, tomorrow, some miracle may happen, something may come. I'll be ready to accept that and incorporate that. That is a different thing. Right now, we don't have any other means than to do root canal treatment, because there is a dead space inside, dead and infected tissues inside. We have to clean them up and fill it up. So here, this cleaning has to be within the root canal. If it goes beyond, if the dentist instrument goes beyond, it causes problem. So it's important to use an apparatus which tells you exactly where the root canal is ending. It's not impinging onto the surrounding tissues. So that is called apex locator. It is interesting if you go to dentist and ask, okay, you are going to do my root canal treatment. Do you have an apex locator? They see on the X-ray and do it's a guesswork. X-ray is a two-dimensional picture of a three-dimensional area. They never come to know what exactly is that correct root canal length. And also the instruments which can clean. So, we think root canal means it is a wide canal going and tapering. It is not. I don't want to go into technical details. The canal comes, and when towards the tip of the root, sometimes it widens. This we cannot see in the radiograph because it's in the other direction. Okay, X-ray we are taking from here, this direction. We call it buccolingual. But mesiodistally, if we take an extracted teeth and see like that, the canal is wider towards the tip. So majority of the dentists who use the instruments which are addressing, they are keeping the tip of the root canal the smallest dimension, and it is not cleaning. So when I told the length is critical and the width of the canal. So actually majority of dentists are not addressing the width of the canal at the tip of the root. So when we address this width, I was doing the, we call it biologically optimal width. Each tooth has a different width. So you should be able to find out. Only some specific instruments can tell you that, which majority are not. I can say safely nobody is using that here. So when you really address the working width and fill it up, okay, you are inside the canal, it's totally cleaned and filled up, the tooth remains healthy. You can use the tooth for chewing for the rest of your life. It's another thing that it has to go for a cap, because that can lengthen the life of the tooth. Otherwise, it may fracture after some time because the tooth becomes brittle because there is no nerve inside, and other reasons, many other reasons. I don't want to go into technical details. So, what do you understand? When the tooth has come to a stage when root canal is needed, it is needed, period. There is no other way. Otherwise, you go for extraction, yeah, go for implant. The implant companies want to push implants. So they will say, no root canal, just knock off the tooth, put an implant. And when the tooth which the God has given us, that could not last your lifetime, man-made thing is going to last more than that. Just think now. I always tell in all my lectures, I believe the best thing that man can do is always inferior to that which God has given us. So you fail to protect the thing that God gave you, and you think you are going to protect this implant for the rest of your life? You must be joking, correct? Okay, so when root canal is needed, it has to be needed. It has to be done in the proper way. So, yeah, I think I have covered these three aspects. So, you think about that. Anything you are putting into the mouth, think, is it going to stick inside? Should I clean thoroughly? Or before picking up anything to put in your mouth, just think, do I really need to put this in my mouth right now? Am I hungry? What am I doing? So, this thing will go a long way to help you. And also train your kids. If you yourself are not trained, you cannot train your kids. We used to feel so bad, no? The small kids with milk teeth. Milk teeth had to go for root canal treatment. Painful situations. The child is suffering. Lack of education from the parents. And parents show a helpless face. We can't. My God, you are the parent, yeah. Take the responsibility and train your kids. So, teeth are important. Small things. Daily brushing at night properly. Don't injure the gums and push in the infection. Okay? Take care and happy life with your full complement of teeth. Bye.